Studies have shown that the cannabinoids CBD and THC present in marijuana plants can fight cancer. CBD and THC fights cancer cells through apoptosis, which is termed destruction by association. They bind to the receptors on the surface of cancer cells and break them down into small apoptotic bodies. These binding to cancer cell receptors impedes proliferation, thereby stopping the cancer cells from reproducing. CBD and THC can slow tumor growth by preventing the formation of blood vessels in tumor cells and stopping metastasis, which is a key step in the progression of cancer. Most of the evidence demonstrating this effect has been conducted preclinically with cells and animals. Anecdotal evidence, which is human stories, self-reported or reported in the media, case reports which are formally published in medical journals, and clinical trials also exist. More clinical trials and case reports are needed to establish the use of CBD in cancer treatments. Several studies have shown that both CBD and THC kills numerous types of human cancer cell lines and shrink tumors in animals. Forms of cancer shown to respond in this preclinical evidence includes breast cancer, lymphoma, colon cancer, thyroid cancer, and multiple myeloma. While both CBD and THC can kill cancer cells, they are more powerful when combined. A recent study examined the potency of CBD and THC individually in comparison to its potency when combined for cancer treatments. In this study, cancer cells were 100% viable when untreated, 50% viable when treated with THC only, and 70% viable when treated with CBD only. The cancer cells showed no viability when treated with CBD and THC synergistically. One of the most well-known case studies is from November 2013 from Case Reports in Oncology Journal, which reported on a 14-year-old female with terminal acute lymphoblastic leukemia. She used THC-rich CBD oil as a last resort after chemotherapy and radiation failed. Blood tests indicated a dose-response relationship between CBD intake and cancer cell count, as doctors tracked the cancer cell count while using CBD oil. There was a marked decrease of leukemic cells and she was cancer-free after 78 days. Fortunately, she passed away as a result of gastrointestinal perforation from the previous conventional treatment. However, doctors recorded that the therapy increased the patient's vitality, had no toxic side effects, and controlled the cancer cell count. A more recent story focused on a woman named Dee Mani who was diagnosed with triple-negative breast cancer in March 2017. She decided to pursue THC-rich CBD oil as the sole therapy. She took 1 drop in a capsule every night before bed. Doctors determined she was cancer-free by August 2017. Other cases include Lynn Cameron, who survived brain tumor using CBD oil after being given 6 to 18 months to live. Augusta Fleming survived stage 3 lymphoma using CBD oil after a full course of chemotherapy was ineffective. And Gary Hill survived lung cancer using CBD oil after being given 6 to 12 months to live. Although a lot needs to be established before THC-rich CBD oil can be passed as a direct treatment for cancer, it is already working wonders for some users. Choose CBD oil. Live healthy, live right.